Now to the global alert over Ebola. This morning, the outbreak in West Africa continues to spread. The World Health Organization declaring it an international public health emergency. The latest numbers, more than 1,700 infected, more than 960 people dead. And here in the U.S., new worries over whether we're prepared for future viral threats. Here's our chief medical editor, Dr. Richard Besser.
Hollywood's given us the catastrophic scenario in movies like Contagion.
When did we run out of body bags?
2 days ago.
A killer virus raging out of control. And in West Africa, it's what experts say is happening right now. In Liberia, health workers in protective gear struggle to collect bodies from terrified residents, trying to keep the healthy away from bodily fluids that transmit Ebola.
Do you know when the person in this house died?
Yeah, this morning. She died early this morning.
And while this new outbreak shows the horrors Ebola can unleash, it's not the only viral threat out there.
Influenza, I think, is still one of those we need to really keep an eye on. It's always surprising us by doing things we're not expecting.
Just 5 years ago, H1N1, or swine flu, killed more than 150,000 people. In 2002, 8,000 cases of another virus, SARS, raised alarms in Asia. And HIV has killed 30 million. And while a successful treatment was eventually developed for HIV, for Ebola, there's none yet. Like many viral threats, Ebola was likely introduced to humans through animals who carry it without getting sick.
What our work is focused on is understanding what's out there that could potentially harm us.
3 years ago in Cameroon, we joined Nathan Wolf, a virus hunter, who scours the African rainforest to identify new contagions that might be slumbering in the jungle before they find us. When humans come in contact with their blood, either hunters or people preparing animal meat, a virus can jump to people. Wolf and his team monitor not only the animal blood, but the blood of local hunters in drops stored on cards.
How many of these cards have you collected so far?
Almost 20,000.
20,000
samples, yeah.
Whoa. And this looks like the kind of lab I might see at the CDC.
Absolutely.
The hunt for crucial links, which so far have proved elusive.
There are a lot of things we don't know about. And the fact is that we've never correctly predicted, or even predicted at all, any pandemic or emerging infection like an Ebola outbreak until it hit the human population.
Worrying signs for the future as experts race to contain the latest outbreak.
Our thanks to Dr. Besser. Let's take this on now with our experts. Dr. Frank Glover is a medical missionary who worked in Liberia with the Christian charity SIM. And Robin Sanders is the former U.S. ambassador to Congo and Nigeria. Welcome to you both. Dr. Glover, I want to start with you. It seems like the two patients who are now in Atlanta are doing much better. Are we out of danger of the virus spreading within the United States?
Dr. Glover.
Well, no, we aren't out of that danger. This is an international public health emergency. The World Health Organization just declared on Friday, and we're still seeing new cases and new suspected cases popping up in places like Europe, Canada, and of course in Nigeria.
And back to Africa, you warned Congress this week that unless something is done, this Ebola outbreak could spread tens of thousands. What has to happen in order to prevent that?
Well, what has to happen is immediate protective gear must be given to the workers that are on the ground. There's been a large death toll from the nurses and doctors that are trying to treat this disease. The health system has completely collapsed. And by that I mean they don't have capacity even to see patients. Every day they're seeing patients mothers present with dead babies in their womb because there's no one to do a C-section.
And they're not really getting these protective suits. They're not getting what they need.
They're not.
Ambassador Sanders, you were the ambassador to the Republic of Congo during previous outbreaks. Those outbreaks were in 2002, 2003. Why is this outbreak in Western Africa different?
Well, the main reason is the population density. In Congo, they were in remote areas. This is population density in Monrovia and Liberia. Certainly in Nigeria, the population lives very closely together. So it's very difficult to quarantine, and it's easier for the spread of the virus because you have such close quarters.
Both of you, you've talked about what needs to happen, what will happen, what can happen. It seems like this is desperate and this is just going to go on.
Right, there are a couple of things. One, I think the civil aviation authorities as well as the Border Patrol authorities across all of the countries that are affected need to communicate better. They need to ensure that they are not only quarantining but having zones of movement. I think one of the things that gets left out of this discussion in terms of how the virus gets into the human population is the food security issue. And you're facing that now in Liberia, where people are quarantined, they were not told in advance, and therefore there are food shortages in those same areas. How the virus sometimes gets into the population is that people are food insecure, so they eat bushmeat, rodents that are affected with the virus, and that's what's happening.
Just very, very quickly, Dr. Glover, to the people in the United States, what would you say in terms of being afraid of this?
Well, I think that our health system is obviously much well-resourced, and we have the capacity isolation centers in hospitals all over the country. So this isn't something we should panic about, but it's something we should be concerned about. And the CDC has made recommendations to the doctors in this country about what precautions to take. People coming from West Africa or affected countries would need to be isolated and observed to be sure they don't develop symptoms.
And it seems like they're doing a good job with that so far. We hope that continues. Thanks very much for joining us.